Hello, it's Dmitry again. Today I'll be going to a new textbook, as you can see here. It's a First Aid TM, Clinical Algorithms for the USMLE 2CK. Includes illness vignettes followed by step-by-step algorithms to illustrate the clinical decision-making process. Written by medical students who recently excelled on the exam, organized by symptom to mirror actual clinical practice, a one-of-a-kind resource to aid in making a diagnosis and formulating a treatment plan. And of course, it's provided by McGraw-Hill. Now, here's the thing from my perspective. I just wanted to give an introduction because originally, as you can see, these are the pages right here. I wanted to give an introduction because of the fact that there is a method to the madness, essentially, in later chapters that I wanted to kind of give an explanation to initially. So hopefully I can only briefly go over this before, if you need to, if you want to say, what does this mean? What does this mean? And it'll help you figure out what's going on. So let's go do that now. So let me just briefly go over this. I hopefully won't not be too lengthy. And hopefully this book will be of utility because basically I read that previous textbook, Melman Medical Internal Medicine PDF, and it has a lot of utility to it, certainly. But I believe this will also have its own advantages to it, which might be worth reviewing. So I'll try to do that in these coming days. Maybe I change my mind. I'll have to see. So introduction. Why should I use this book? We're excited to introduce the First Aid Clinical Algorithms for the USMLE Step 2 CK, a new and improved study tool to help you excel on the Step 2 CK. Unlike other textbooks that present diseases by shared pathology, this book organizes material by presenting the symptoms in algorithms meant to demonstrate the clinical reasoning that should be used to answer the question on the test day. Many chief complaints have broad differentials that are often not helpful to consider in their entirety for any given patient. Instead, a clinician or test taker should notice a few initial clues to narrow the differential from, say, dizziness to vertigo or a cardiac arrhythmia. Say dizziness to vertigo or a cardiac arrhythmia before developing a differential diagnosis. In this book, this step is organized by meta-algorithms that show the steps to reach a more specific chief complaint, for which there is an algorithm/high-yield format page. From the broader chief complaint, dizziness to vertigo, these pages serve to describe frameworks for a chief complaint and the initial salient features to note. Algorithms present, and you can also, by the way, skip ahead in the video if you want to go into the parts where I'm explaining what the different boxes mean. This is green, this is yellow, what does this mean, that kind of thing. So if you want to go do that, you can skip ahead as well. Anyway, algorithms present in a visually clear way the most vital information needed to discriminate between similarly presenting diagnoses and the correct timing for the different management steps. The benefit of this format is that it helps readers to distill the information overload often present in Step 2 questions stems to the salient information that is needed to answer the questions quickly and correctly without being bogged down in unnecessary details. So true. Huge factor when you look at these exams. If you're taking Step 1, or if you're taking Comlex 1, you can see some, and for that matter, you take all these things that are preparatory for that, they can produce these really long questions, and you ask yourself, what is even really going on with this question? You're in a sort of time-sensitive situation, and I feel increasingly now, for me personally, at least doing the review of this information in preparation for shelf exams, and eventually for the board exam, I feel obligated with these test questions to just kind of read the last sentence and then kind of figure out what I need to be looking for. Well, I'm trying to be more efficient in using my time because it's a very time-sensitive situation. And they have a lot of text that really isn't of that much value. So, anyway. The book is comprised of paired algorithms and high-yield facts, pages so that for a given chief complaint, the diseases that should be on your differential will be included in an algorithm that provides a step-by-step method to guide you from the chief complaint to the correct diagnosis and initial treatment. Accompanying each algorithm will be the high-yield fact page, which lists the diseases from the algorithm and includes pertinent high-yield information that is not present in the algorithm in particular, a brief clinical vignette, management steps, and potential complications. Why should I use this book? They just asked the same question twice. Why should I use this book? Why should I use this book? Question mark again. Okay, sure, why not? Q&A, but it's the same question. How should I use this? How should I use this book? Okay, how? I'm sorry, that's on me. How should I use this book? It will be most helpful to begin using this book early in your clinical education as you prepare for the start of clerkships. The specialty-specific chapters are designed to be study tools for the shelf exams and will also provide frameworks for the patients and diseases you will encounter on the wards and in clinic. As you work through the chapters on each clerkship, you will be well prepared to review the book as a whole when studying for the Step 2 CK exam. This book will help you answer these 6 primary types of questions on the Step 2 CK and shelf exams. 1. Diagnosis questions simply ask you to diagnose the condition based on a question stem and set of data. The algorithm as well as the clinical vignette on the high yield fact page should be studied to answer these questions. 2. Treatment questions ask you to identify the appropriate treatment for the described condition. Often you must first identify the condition based on the question stem. Studying the algorithms and potentially further treatment steps on high yield fact pages should prepare you well for these questions. 3. Best next step questions ask you to implicitly form a differential and then decide the next step in either diagnosis or treatment. Oftentimes, the specific diagnosis is not clear, but a management step must be chosen anyways. The algorithm format is ideal for thinking through these questions. 4. Complications questions ask you to predict the treatment complication and the patient is at risk for developing based on the drug or procedure indicated once you know a diagnosis or treatment. Use the algorithm to determine the diagnosis and then the complications are listed in the high yield fact page. 5. Differentiate questions. Ask what essential diagnostic test will differentiate one diagnosis from another. Closely related diagnosis. The algorithm format is designed to focus on these essential diagnostic steps. 6. Facts questions ask for specifics on a disease once you have identified it, such as the epidemiology, optimal populations are at risk, and pathophysiology. The highest yield facts are covered in the high yield fact page. Well, that would make sense. The algorithms are best used alongside practice questions. After you finish a practice exam or question set, use this book as you review incorrect and correct answers. Interesting. Identify the chief complaint and turn the corresponding meta-algorithm or primary algorithm. Alternatively, as you glance through the answer choices, identify the algorithm that best includes these. Work on your way down the algorithm using the data provided in the question stem. If you made a mistake in the workup or sequence of management, it should be clear that what the mistake was and made based on your algorithm. If you answered correctly, tracing your steps down the algorithm will help to reinforce your reasoning. That's an interesting way to study. Okay. Fair enough. The algorithms can also be used to help you understand clinical decision making on the wards or to provide guides for brief on-round teaching on the management of specific complaints. However, it should be noted that the instance of conflict, this book favors the test-correct approach, and occasionally this approach may differ from the usual clinical practice. So this book prefers what the test is going to say, not necessarily what's going to happen in reality. Because, of course, education is geared towards doing well on tests, not necessarily, in principle, or at least in function, what's actually accurate about material reality that we see amongst us. There's a degree of discordance, even though there's supposed to not be, in theory. Anyway, anatomy of an algorithm. The algorithms are designed to follow a similar structure across the book. Information is embedded via the written text as well as through colors, symbols, and shapes as the reader becomes more familiar with the formatting. Throughout the course of the book, the meanings of these non-textual signifiers will become second nature and not require frequent referencing of the key included below. So here's a little graph we have right here. So let's say for example, let's go for this. Temperature greater than 38 degrees Celsius or 100.4 Fahrenheit. Let's say for example, we're saying it's post-operative days 1 to 2. We have wind, atelectasis versus pneumonia, and then we go down here, it says respiratory symptoms. Let's say the symptoms we go for chest x-ray. Chest x-ray, let's say we found consolidation. If it's consolidation, we're thinking pneumonia. If it's pneumonia, then we go for antibiotics plus supplemental oxygen. See how that works? Here's a little footnote here. It says here, the 5W is mnemonic for the causes of fever in the post-operative period is wind, water, wound, walking, and wonder drugs. These five causes are time-dependent and thus typically occur in a predictable sequence. One cardinal signs of skin and soft tissues infection, redness, warmth, swelling, pus, do not push eviscerated contents back into the body cavity due to infection risk. Cover with sterile material before taking the patient to the OR. Okay, so what is the actual anatomy of this whole thing? We're talking about the anatomy. What is this? So chief complaint, start with chief complaint. All algorithms start with a chief complaint that brings you to that algorithm. It can either be a symptom of cough, sign, macular rash, or lab value, hyponatremia. Workup, gray box. You see the gray box right there. Next will be a box with an element of a workup that will help discriminate the different pathways that will take you to the correct and alternative diagnoses. This can be a lab test, imaging test, physical exam finding, or an element of the history. See here, you see the urinalysis and culture. Positive and negative branches. If the element of the workup is positive, follow the positive sign. If it is negative, follow the negative sign. Fair enough. All branches have arrows to indicate the direction of the clinical reasoning from chief complaint to diagnosis. So you see the plus and minus sign. Findings, green box. Often the element of the workup does not have a binary plus or minus answer, positive or negative answer. In this case, the finding from the workup step will be the next box below. So you can see that hypercarbia, tachycardia, muscle rigidity. Okay, that's the findings. Diagnosis, which is the gold hexagon right there. After steps, you will have reached the diagnosis. These are in bright color and larger font, so you can immediately see all the diagnoses present on a given algorithm. That is to say, the differential diagnosis for the chief complaint. In this case, they're showing atelectasis as the example. What about treatment? Blue box. Treatment steps will stand out from the workup by the blue color of their boxes. They can be empiric treatment steps before you have reached the diagnosis, or direct treatment that are below after the diagnosis. So antibiotics plus supplemental oxygen is the treatment for this condition. What about symbols? Symbols in workup and findings boxes. The stethoscope symbol indicates a physical exam maneuver or finding. The test tube indicates a lab test, and the microscope symbol indicates imaging study. So microscope for imaging study, test tube for lab test, and then the stethoscope for physical exam test. Footnotes, the detailed information that is necessary for understanding the algorithm, but too lengthy to be suited for the graphic algorithm, is included in the footnotes with the numbered superscripts to link it to the appropriate place in the algorithm. Images are included when they are likely to show up on the test questions as important pieces of data to narrow a differential, such as classic radiology or physical exam findings. And that's basically it. That's the end of the section that I wanted to read for you today. So, I put that out there just because I wanted to make sure that, I guess, maybe for myself as well, but also just for people who would be listening. Let's say they wanted to go read my presumably future video on cardiology for internal medicine. They would know what these graphs are about, what's going on here. What is the footnote? What is this, chief complaint, so on and so forth, that kind of thing. Like, what does this mean? Now you know what the green and the yellow hexagons and all that other stuff means. Right here, you understand the concept of how things work. So if you had a video in the future you wanted to see, now you would feel presumably less confused. So hopefully that's of utility to you if you were going to watch this series. And of course, it's hopefully useful for me because I'm the one reading the textbook in the first place for my own personal endeavor, I guess you could say. So regardless, have a great rest of your evening, morning, night, afternoon, whatever it may be, wherever you may be. Thank you, and goodbye.